Between your great new product and the users who will love it, sometimes there's a gatekeeper. And in healthcare, there are a lot of gatekeepers. That's what I found when I started my company, DohJe, 4 years ago. We discovered 5 key gatekeepers who loved our idea for bringing more gratitude to their staff, but they each had concerns that initially kept us from launching. I'm going to share how we converted each of these gatekeepers into advocates. I was a grateful patient that wanted to thank an amazing nurse after the birth of my son, but there was no easy way to find and thank her after I got home. Being an entrepreneur, this seemed ridiculous to me, so I set off to fix it. I talked to hundreds of nurses, doctors, and hospital administrators. I learned that nurses and other team members are doing more with less, feeling stressed, and many are approaching burnout. Hospital leaders know this is a problem they need to fix. So how do we turn the gatekeepers into advocates of our solution to their burnout problem? First, we needed to understand how our product could save money or make money for hospitals. Gratitude is great, but hospitals are a business after all. It was fascinating for me to learn that hospitals with higher patient satisfaction scores got reimbursed at higher rates from insurance companies. Which hospitals get the billions of dollars in these incentives is determined by patient satisfaction surveys. We help hospitals get reimbursed at the higher rates because appreciated staff provide a better patient experience. We also save money for hospitals because you improve morale of the staff, you also reduce retention. So why would the gatekeeper still be blocking us? At first, all we kept hearing was HIPAA. HIPAA refers to patient privacy laws. So why is the word HIPAA on a hippo? I don't know. And I also didn't know why HIPAA should be a barrier to patients thanking their caregivers. Until we talked to the COO of Stanford Hospital. He explained that patients can say anything, but caregivers cannot. HIPAA requires that caregivers respond without any specifics about the patient to protect patient privacy. So what did we do? We iterated our product and we added pre-written general responses, like these. Thank you so much for your note. I'm just glad I could help. And your kind words mean the world to me. You are so welcome. Roadblock removed. So after we got past the HIPAA concern, the VP of HR said that nurses would never be listed on our website and they certainly wouldn't put their photo on there. Why? They've just never done it. But we know the photo is critical because patients can't always remember a name. So we asked if we could run an experiment. We set up photo shoots in unused hospital rooms like this one. Our hypothesis was that if you had a nice photo, you're much more likely to put it online. Turns out we were right. Over 90% of the staff put their photo on DohJe once we had a good picture of them. So it's important to remember that gatekeepers can influence features, but they should not dictate them. Part of the art of turning gatekeepers into advocates is knowing when and how to push back. The manager for this unit at UCSF was a very important gatekeeper because her team of 140 people were going to be our initial pilot users. So when she asked if we could replace paper cards for coworker gratitude, we decided maybe this time we'll listen. We added the ability for coworkers to thank each other on DohJe. And this time it was a good decision because you can see from the blue, over half of the 645 total DohJe notes were coworkers thanking each other. So sometimes you listen, sometimes you don't. But beware of the unexpected gatekeeper. Before the UCSF pilot, we had gotten buy-in from the COO, VP of HR, and chief nurse at another major hospital, but the deal screeched to a halt when we found out that the fundraising group was afraid that if patients could thank their caregivers directly through DohJe, then less would donate to their Grateful Patient programs. It sounds crazy, but it's what they're measured on, so it's human nature. So what did we do? We added a link to donate to the hospital after sending a thank you note. Gatekeeper, now advocate. So if you can turn your advocates or gatekeepers not just into advocates, but into heroes, they will champion your product from inside the organization, and the best way to influence an organization is from within. So what should you remember about the art of turning gatekeepers into advocates? Successful entrepreneurs set the context to make choosing easy. What does that mean? That means that if you understand what's really important to your gatekeepers, you can make small feature changes that eliminates the gatekeeper concerns and still creates the best product for your end users. So where are we at today? Our customers include leading medical clinics like Kaiser San Francisco, and a Harvard study has proven our success. Our newest gatekeeper, the CIO, is being converted into an advocate by creating interaction with the IT systems. So that's me.